As far as I'm concerned, and I hope this view is adequately represented, those who attempt to dispel the notion that HIV is the cause of AIDS are perpetrators of death. And I would very much, for one, like to see the Constitution of the United States and similar countries have some means in place that we can charge people who are responsible for endangering public health with charges of endangerment and bring them up on trial. I think that people like Peter Duesberg belong in jail.
Question what you were being told about your diagnosis?
No.
Hey, I'm Christine Majori. I'm convinced it's wrong to encourage HIV testing and to administer death sentences to people who test positive. The HIV test is well documented to cross-react with numerous non-HIV antibodies that can be found in normal, healthy people. They read these as HIV antibodies and give a positive test result. Cold, the flu, flu shots, hepatitis, herpes, rheumatoid arthritis, other immunizations, and pregnancy can read as HIV positive on these tests. Pregnant women who test positive are told they have to take this AZT or abort. That's an actual AZT label. AZT is a chemotherapy. It's a known carcinogen and works by destroying DNA chains as they're forming in the body. It causes severe anemia, so severe people need blood transfusions. It causes muscle wasting, neuropathy, diarrhea, dementia, spontaneous abortion, fetal deformities, and lymphoma. As we meet here today, there are parents across the country who risk losing their children to state custody for their refusal to give their children AZT. Next week in Eugene, Oregon, the parents of an HIV-negative baby are being charged with negligence and intent to harm for objecting to orders to give their baby AZT. This baby's father is HIV negative, his sister is HIV negative, and he's HIV negative. But since his mother came up positive on an HIV antibody test, the state says that they must give this HIV negative baby AZT, and she cannot breastfeed him. This isn't public health policy, this is madness.
Our pediatrician came to take a look at him, and she gave him a little checkout and said he looked great. He apparently was very healthy, and all his vitals were working right, and everything was good. He looked like a good, strong, healthy baby. But would we consider a visit from this infectious diseases pediatrician? She came by and looked at Felix and also agreed that he was a very healthy-looking baby, looked fine, but urged me to stop breastfeeding right away and to start the AZT treatment for him. That was really the best thing to do in this case. So we talked with her for a little while about why we had decided not to, and that, you know, we really had based our decision on a lot of research and a lot of soul searching and, you know, just kind of the basic information that we had about our own health and the health of my daughter and especially my health. She was just rather strident and informed me that she would be going to the ethics board of the hospital and would be consulting with the hospital's attorney. The petitioner from juvenile court walked in my room with a Eugene police officer, a police officer with the gun and the holster and the radio and the little book and, I mean, the whole uniform and everything. Basically, I was told that, you know, I really needed to stop breastfeeding right away, and I really needed to start giving Felix the AZT right away. And at this point, I was in a panic. And so, you know, I hit the buzzer, told the nurses to please come in now and bring the formula bottles and the bottles. And I would start it right then. So that's what we did. But it didn't make any difference because we were already caught. in the process. Didn't make any difference. So I realized then, I read the paper, that my son was no longer in my custody, in my legal custody, and that he was, as of that moment, under protective custody of the state of Oregon. And that they would leave him with me, but with those kind of orders and that kind of paper in your hand, you realize that, you know, nothing is certain. I would put it in a syringe without a needle on it, and I'd put this little teeny tiny tube on the end of the syringe, and then I would tape the tube, the end of the tube, onto my finger. And then I would squeeze the syringe, and I'd watch that medicine go down the tube until it got right to the end. And then I would put that finger in my baby's mouth, and he would start to suck. And then I would have to squeeze that syringe until it was all the way down. Then there was still some left in the tube, so I'd have to take the syringe off the tube and then draw up some formula in that syringe and reattach it to the tube and then push the formula through so that he would get all the 0.65 milliliters of AZT.
3 months into the pregnancy, they tested me. I came up positive. We fought them, saying we didn't believe it, put them off, we don't want the drugs, for 2 months, and we agreed to start the AZT 5 months into the pregnancy. And that's when they took us down. They put us in an office. We had these stack of papers, and we just signed it all.
She was doing seizures for a while.
Yeah, she did some
Or
seizures.
she'd be sitting there and her face would just kind of tighten up, and then
And
she'd
her
snap
eyes would
out
roll
of it.
back in
Yeah, her
her
eyes
head.
would roll. And then she, that one time on the couch, we came out and she was convulsing.
Right.
And we called the 911. She had a lot of fever-related seizures. She's been very, very, very hard to raise. And I know that she was poisoned. She's a different child, and it's everybody, a lot of people know. Rachel is going to lead Rachel's life.
Right.
And Rachel physically seems to be fine. Who is that?
Hayde.
She can't say 1, 2, 3. She can't say one. You can't. No, she can't count to 3, and she can't say ABC, and she can't say her name, and she can't tell you how old she is. And sometimes in her head, I mean, she wakes up in the middle, like crying sometimes, and like in pain, just screaming, and it's hard to see what's going on with her, and it really hurts me. And I feel somewhat responsible because I let those doctors give her those drugs.
And I don't think that Paul and I can really say that there's anything specifically wrong with her, because I don't
She's
think
just
anybody
different.
can really tell.
Rachel's different.
She's just different.
Some of the concerns that I guess the dissident side raises is that AZT is contraindicated for everyone except pregnant women, children, and people in third world countries. How does that work? What's your response to that?
Well, that's an absolutely ridiculous position. It's totally false. We give AZT all the time to patients with HIV disease.
In monotherapy?
No, we don't use monotherapy ever. We use AZT as part of a combination regimen. But let me ask you something. Do you believe that HIV causes AIDS?
That's the general position. I mean, that seems to be the prevailing wisdom on it.
Do you personally believe that HIV causes AIDS?
I don't have enough information either way, personally.
Are you one of the dissidents?
A dissident? No.
How can you say you don't have enough information if you're doing a documentary on this topic?
I'm forming an opinion based on the information that I gather.
Honestly, Robin, if you're at this meeting, you should have had an opinion formed before coming here.
That's not necessarily true. That's not necessarily true. I mean, I can see that you're a man who stands powerfully behind that idea.
I stand powerfully and passionately behind that idea.
I see that.
And I'm concerned that if you are someone who is going to waffle on this topic, that you will attempt to edit my remarks in a way that will make me look foolish.
I will not do that. I'm not out to take anyone's dignity or anything. I'm trying to put together a series of interviews that bring enlightenment to the subject. That's it.
As far as I'm concerned, and I hope this view is adequately represented, those who attempt to dispel the notion that HIV is the cause of AIDS are perpetrators of death. And I would very much, for one, like to see the Constitution of the United States and similar countries have some means in place that we can charge people who are responsible for endangering public health with charges of endangerment and bring them up on trial. I think that people like Peter Duesberg belong in jail.
Well, you closed the door in front of me. I wait patiently outside. As the minutes tick away, I feel the anger rise. Who's the object of my rage? Who's not being fair? Is it you